everyone, welcome to the North America Bilingual Media. Today we will continue to report about American vaccination. Seems like COVID-19's vaccine is getting closer and closer, but when will we be able to inject it? U.S. experts convened to decide whether to okay Pfizer vaccine.
The government advisory panel convened on Thursday to decide whether to endorse large-scale use of Pfizer's COVID-19 vaccine to help contain the outbreak. The meeting of outside advisors to the Food and Drug Administration represented the next-to-last hurdle before the expected start of the biggest vaccination campaign in U.S. history.
Depending on how fast the FDA signs off on the panel's recommendation, shots could begin within days. The FDA panel functions as a science court. During the scheduled day-long session, it was expected to debate and pick apart the data in public on whether the vaccine is safe and effective enough to be cleared for emergency.
The initial supplies from Pfizer and Moderna will be limited and reserved primarily for healthcare workers and nursing home patients, with other vulnerable groups next in line until the shots become widely available on demand, something that will probably not happen until the spring. A meeting of experts on vaccine development, infectious diseases, and medical statistics came as the coronavirus continues surging across much of the world, claiming more than 1.5 million lives in the process, including about 290,000 in the U.S.
Hanging over the meeting was a warning from British officials that people with a history of serious allergic reactions shouldn't get the vaccine. Government authorities there are investigating 2 reports of reactions that occurred on Tuesday when Britain became the first country in the West to begin mass vaccinations against the scourge.
Pfizer representatives told the panel that they're aware of the British reports but have seen no signs of the allergic reactions in their trials of the vaccine. A positive recommendation and speedy U.S. approval appear nearly certain after FDA scientists issued an overwhelmingly positive initial review of the vaccine earlier this week.
FDA said results from Pfizer's large ongoing study showed that the shot, which was developed with Germany's BioNTech, was more than 90% effective across people of different ages, races, and underlying health conditions, including diabetes and obesity. No major safety problems were uncovered. Common side effects included fever, fatigue, and pain at the injection site.
The data presented in the briefing report were consistent with what we heard before and are really exciting, said Dr. Lanwa, head of Johns Hopkins University's International Vaccine Access Center. Nothing that I see would delay an emergency use authorization.
The meeting also represented an opportunity for regulators to try to boost public confidence in the breakneck development process that has produced the Pfizer vaccine and a string of other upcoming shots with remarkable speed, less than a year after the virus was identified.
This is the current vaccination report. We will continue to pay close attention to the new reports. Thank you for tuning in. This is North America Bilingual Media.